Hello, my name is Teva, and today we're going to talk about the proposal of the correlation between the spinal alignment and nutritional absorption. So, for the introduction, basically, we're talking about the connection between spinal alignment and the overall health in our body, and that's really something that's has growing interest within the chiropractic community and other medical health providers, and it's specifically talking about how misalignment in the spinal cord, which is also known as a subluxation, which is basically just a shift in the spinal structure. Think of it, it can even happen through posture over time or from like a whiplash, like a sudden injury. And basically what it does, think of it like a garden hose. Like if you have a kink in the hose, in your garden hose, what happens to the flow of water? Right? It like trickles. So rather than having a fire hose where it shoots out energy, it's just trickling energy. So that's basically when a misalignment or subluxation happens in the spine. It's basically like a kink in the hose rather than a fire hose. So we're going to go over numerous studies which highlight the importance of the spinal cord regarding the absorption of nutrients in the autonomic nervous system, and the study proposal aims to address the gap in the current literature regarding the relationship between the thoracic spinal alignment and the nervous system, and ultimately how that affects the nutrient absorption efficiency. We have Zhang et al., writers of interactions between autonomic nervous system and peripheral metabolic organs. They state that the brain can regulate our internal organs and glands through the autonomic nervous system and neuroendocrine system. So basically the brain sends energy to all the organs in the body through the central nervous system, which is the brain and the spinal cord. Roger Sperry, a Nobel Prize winner on brain research, said 90% of the stimulation and nutrition of the brain is generated by the movement of the spine. So, since the brain sends energy to all the organs in the body through the nervous system, then the spinal cord really just is that bridge for communication between the brain and all the organs in the body. And Rock all, which are writers of Anatomy of the Intervention of the Abdomen, they basically explaining how segments of the thoracic spine are crucial for the sensory intervention for the abdominal functions and the digestive system. So if there's a kink in the hose in the thoracic spine, the upper back, then that's what sends the information directly to the digestive system. So having a kink in the hose, it's limiting the flow of energy and ultimately affecting the flow of nerve energy, which goes to the digestive system, which can make an impact on the absorption of nutrients, since that happens in the digestive system. And this final article on the literature review is led by the senior author, Dr. Deed Harrison, and throughout his career of research for CBP, chiropractic biophysics, he has 264 publications, 7,198 citations, and for example, this study is a randomized control design study where they follow lots of double-blind studies just to avoid any bias and errors. So for this study, basically what they talk about, the quote, restoration of the cervical sagittal alignment in the athletic population had a direct influence on pain, disability, and autonomic nervous system dysfunction. So what they're saying is that when the spine is out of alignment, when it's subluxated, it limits the flow of energy to essential nerve energy to the autonomic nervous system, which part of that is the central nervous system, which is just the brain and the spinal cord. So when the spine is misaligned or subluxated, it may disrupt how the internal organs function, which would affect the function of the small intestines and its ability to sufficiently absorb nutrients. So my hypothesis is that when the spine is out of alignment, it affects the absorption of nutrients. The correlation is strongly evident in the thoracic spines, where the SPNs, also known as sympathetic preganglionic neurons, from the specifically T6 to T12, they send signals to the sympathetic ganglia, which then synapse with the postganglionic neurons. They intervene with the small intestines, which is a primary part of the body which controls the absorption of nutrients. And again, that subluxation, misalignment in this region, it not only disturbs the neural connection, but it also triggers the sympathetic nervous system, which is that stress response of the body. So they're kind of two elements which can affect, because when the sympathetic nervous system is under stress, that's like your flight or flight response, it's basically disturbing the blood flow, which affects nutrient absorption, which is normal. But if you're in a constant state of stress, then it ultimately is creating a bigger impact. So our study, we're going to go over the study population and sample size. Going to have 100 people between the age of 25 and 45 years old. We're going to use a randomized block design where we equally split the men and women. So then each group contains 25 men and 25 women. So 2 groups. I wrote 4 groups there, but there's 2 groups. Regarding who we're going to include into the study, it's specifically patients who are asymptomatic. They must have an optimal sleeping score for the past month, which is tracked for an Oura ring. They must not have any gastrointestinal disorders and can't be on any medications which affect their digestion. So the control group have no spinal misalignment, no subluxation. The experimental group has a subluxated spine. For the procedure of this experiment, both groups are tested for nutrient absorption efficiency using a standardized glucose absorption test. The postures are confirmed via anterior-posterior x-rays, which goes in 3 shots: cervical, thoracic, lumbar, as well as a sagittal view of cervical, thoracic, and lumbar spine. And then it's going to be stitched together, so it's going to appear as a full body x-ray, AP view, sagittal view. That's the best way to determine a overall posture. The experimental group, again, is going to be subluxated, control group not subluxated, and it's going to be really important that none of the patients anyone who's participating in the study, they're not going to see their results, because that could have any placebo effect. So it's very strictly, the person who's taking the x-ray is not allowed to be in contact or to talk to any of the people, so none of those results get leaked out by mistake. There's an optimal sleeping score is measured through the Oura ring sleep tracker. The chronic gastrointestinal disorders are tested using the GI map, and that's a quote explaining what the GI map does. Both groups go through breathwork and meditation for 15 minutes to reduce stress levels. Both groups eat controlled meals under the same conditions, hence why it's controlled. Both containing equal amounts of macro and micronutrients, which is then followed by regular blood tests to measure and ensure the reliable nutrient levels. After measuring the results, the experiment is repeated, but this time both groups get a adjustment prior to eating their meal. So x-rays will be taken to measure the effectiveness of the adjustment before eating the meal. And then after the adjustment, the nutrient absorption is assessed using the same glucose absorption test and blood tests. So here the variables are written out. The independent variables are the control group and the experimental group, while the dependent variables is the nutrient absorption efficiency, which is measured by the glucose absorption test and blood tests, and the control groups was mentioned in the procedure. The expected outcomes. The experimental group is expected to show improvement in nutrient absorption in the post-adjustment, whereas the control group should have similar levels in nutrient absorption. So there's so many studies which explain the difference between how the spinal cord affects the function of the organs and of how it affects the overall body. So what there isn't, it's very missing in the literature, is how it affects specifically the absorption of nutrients. So this study is really going to help identify that gap in the literature, because despite knowing that the spinal cord, especially like the thoracic spine, it affects the flow of energy to the small intestines and the digestive system, which the small intestines is in charge of absorbing nutrients, it is, that's the expected outcome, that it's going to have an effect of the absorption of nutrients when a individual is subluxated. And it would be nice to test not only the thoracic spine but the whole spine, because when you have a problem in your cervical, that limits a flow that you get of energy that you get to the thoracic spine, if it's the communication between the brain and the spine and the organs. So in this study, where it more focused particularly on the thoracic spine, and that how having a subluxation in the thoracic spine affects those functions of the absorption of nutrients, but it would be really interesting to have a more in-depth study of going over the overall function of the spine when having a subluxation, even in your cervical spine, how that could relate, because there are plenty of studies. If you look at Dr. Deed Harrison's research on CBP and his nonprofit, then you'll see plenty of different studies which validate the fact that having a subluxation anywhere in the spine can have a direct influence on different areas of the body. So these findings may also inform clinical practices and guide further research, and that could potentially lead to more effective interventions for enhancing nutrient absorption throughout chiropractic adjustments. Here are the references used, so 1, 2, 3, 4, 5, 6, and then 7, 8, 9, 10, 11, 12, 13, which is just the photo credits. So thank you for listening.